All right, I'm going to go ahead and get started. Welcome everybody to the Athena HCI Workbook webinar. The purpose of this call today is essentially to try to help you fill out the workbook, or at least understand what is needed, since Athena Hub is a connection that we have set up as a hub style, which means it's kind of a plug and play. It's unique in its setup, so it's a little bit different about what requirements we're asking for on the workbook. So I'm going to go ahead and start with a little PowerPoint presentation. We've modified the workbook requirements to fit the need of the Athena folks. So the PowerPoint is not very long, and we'll take questions at the end. If you have questions during, you can put them in the chat, and Dina will help me, facilitate any kind of questions. So let me go ahead and just so that I can have better bandwidth, let me stop my camera and I'll start sharing. Give me 1 second here. Okay. Can you see my screen?
Yes.
Okay.
Oh, I'm sorry. No, I can't.
You can't see it? Oh, hold on 1 second. 1 second. Hi, Karen. How are you doing?
A little confused, obviously.
I haven't talked to you in a long time.
You can see it now.
All right, perfect. Thank you. All right, let's get started. This shouldn't take too long, and we'll give you some time back, hopefully. All right, so the first requirement is that what we're going to want you to do is we're going to want you to complete the workbook. And what needs to be done is we want you to go to, we want to introduce what's needed for the workbook, right? The workbook details and OIDs and why it's important to talk about the OIDs and purchase one. We'll talk about next steps, and at the very end, we'll take questions from you. As you know, Contexture, formerly Health Current, recently announced that we would be merging with the Colorado HIE, and that we would be going to a single platform. The platform is going to allow better analytics, identity management, which means for those of you who get alerts, we won't have any kind of patients that maybe don't match because maybe they're newborns or whatever, they have other names. So the identity management is going to be a huge blessing for us. Additionally, we're going to be on a more stable platform, so this is good news for all of us. The planned go live is for April of 2025, but we need to start working on migrating your data feeds well before that time, right? Because we need to work with your vendor, or we need to work with you to get those, and we need to start testing. So there's a lot of stuff that goes into that so that we can make sure to get you successfully migrated. All right. The only thing you're going to have to worry about in the workbook, and I do want to call out a few things. You may have gotten a workbook when we initially began the rollout, and you got a workbook that since then has been modified, and several iterations later, we've found a couple of things that we needed to add, more details on certain things. So the workbook that you see here may look a little different, or the screenshots that you see may look a little different than the one you have, but it's still essentially the two tabs that you'll need to worry about are going to be the site info and project info. This here is the project info. And the only thing we need on this one is going to be for you to complete rows 21 and 22. What we need from you is who is going to be the primary contact at the site when we get ready to begin testing. Right now, the lead person for this project, the project manager, is Dave, and he has a very good relationship with Athena. He's been working very closely with them. Avni is who we're working with right now, and he's already on there as the point of contact, so you don't have to worry about putting your Athena point of contact. We would just need the clinical or the organizational point of contact. A lot of the testing we're going to be doing alongside with Athena, but there's going to come a time where we're going to ask you to start sending test messages to our new platform, so we make sure that everything is coming in the way it's supposed to. Don't worry about what's down here because that's already been pre-populated. The other tab you're going to have to worry about filling out is going to be the site info tab. This is where you're going to put your organizational name. If you have a parent organization, that's going to go here in that very first column. Facilities, for example, if you are a parent organization and you have multiple sites, please list all your sites that are sending data to us today. If you have a site that's not sending data, you don't need to include that. Only the sites that are part of your data feed. Most of the Athena folks are not Part 2. That means that you don't have any kind of protected data like behavioral health or substance abuse data. And I believe that Athena additionally will not take that data. They actually filter it out from coming to us. So you don't have to worry about that piece. It's going to be non-Part 2 for most of the Athena data feeds. For the parent organization OID, let's talk a little bit about that. That's what we're asking for. So if your organization goes out and acquires an OID, which is one of the requirements, it's a couple of the reason that the requirement is there, and we'll talk a little bit more about it, is because we cannot use vendor issued OIDs, and Athena's setup is such that they always use their own OID, and then at the very end of that OID is going to be your practice ID. That's how they do it. They kind of they have their own branch strategy. We can't accept that. We won't ask them to change anything, and they can continue to send whatever they need to send in that MSH value. We ourselves are going to go ahead and map that so that it matches the OID that you acquire through HL7 registry. Okay. For the facility OID and the MRN OID, don't worry about that. We're good. David already completed all this information for you. So the only thing we'll need is your actual workbook with the site info and all your parent and facility names. Everything else has been pre-populated by him. So that'll be kind of an easy win for you guys. You don't have to worry about any of that stuff. We want to make sure that you do have an organizational OID. So when you do enter the information, please make sure it's not your vendor OID. If for some reason it is a vendor OID, there's a little comment section over on this side. I didn't include it in the screenshot because it was just too long. You can just put it's vendor issued, but we really want you to get your own OID. Let's talk a little bit about the OIDs. The reason that you're going to, as a data contributor to Contexture, we need your own unique OID. And one of the reasons that we need your unique OID is because in the event that one day you decide that you are no longer going to be part of the Athena Hub connection and you go to Epic or eClinicalWorks, you don't have that OID anymore. You're not the owner of that OID and you're not the owner of that data anymore. Even though you're the one sending the data, that data is already in our system and it's applied to an OID that's issued by a vendor. If you do move to another vendor, we would always want you to have an OID so that we can recognize that you're the data sender and the data owner for all that data. That's one of the reasons. Secondly, is because our new the new platform, our new vendor requires that you have your own registered OID. That's a requirement for HCI. So can't get around that one, but we do not want your vendor OID. Again, we won't ask them to change anything. And if for some reason you do have multiple locations, we can branch your OID. In other words, we will use your parent OID that you registered with on HL7 registry. And then what we'll do is we'll go ahead and allow us to go ahead and branch any locations that you have. So you don't have to do anything. We'll take care of all that for you. Unless, of course, you have a branching strategy and then we'll adopt yours. But I think for the most part, since you guys have vendor issued OIDs, most will not have that type of strategy. All right, questions about OIDs. I kind of want to talk a little bit about questions. So if you want to raise your hand or any questions about the reasons for the OID, or if you know how to register for an OID. All right, I'll take your silence as we're good. So let me go to the next one. What happens next? All right. For Athena members and clinical participants, since they function as a hub, we call it a hub and spoke. This means that all the participants have the same type of integration and connection. That means that the details in the workbook that's already been pre-populated, we already have all the technical information that we need, which we got from Athena. So you don't have to worry about that piece. However, we do require that you fill out the project info tab, which is where you have all your contacts, because that's how we're going to get a hold of you. That's the only way we can get a hold of you is if you include your email and your name. The site info tab, which includes your OID. So hopefully by the time you submit that workbook over to us, you'll have your own registered OID. And then of course, registering an OID through HL7 registry. The delivery, the timing, and the processes are still being finalized between Athena and Contexture. And so once the migration is process is completely formalized, those details will be shared with the participants, and that's the reason we need your email information. What that means here is that David is working with Athena. What we don't know yet is if they're going to require you to enter a ticket with them or a case with them. That's information that they're still working on over at Athena internally. So there may be a need for you to enter a request, but until that's formalized, we're going to leave it like that for now. We'll reach out to you if you require a ticket with them. Also, our vendor support is working with, for all the technical details. We're actually we've already set up the VPN with them. And next step is to start some initial testing. We're going to just use one site for now. And then if everything looks good and after they fixed everything, then we'll proceed with onboarding you. You'll get an email from a PM letting you know, hey, we're ready to kick you off. And then we'll let you know what the path is for each one of those. Sometimes you might get an email letting you know, hey, we're already in the process of testing your data. Not much for you to do other than maybe we want you to send some test messages. All right. Reminders. We need your workbook completed in its entirety so we minimize any delays. So if you leave off something, we're going to send it back to you. And we just want to make sure that we call that out so that we don't, cause any delays to your data feed being migrated. If you have questions about the workbook or anything else, you can always email vendor support. The team is here to help you. We have availability. I posted the availability that we have. So feel free to either email us to let us know that you want to meet. And then additionally, one very important note is Contexture cannot guarantee that we can migrate your inbound data feeds to our one platform if you do not submit a workbook or if you do not acquire an OID within the required timeline. What that means for you is if you don't submit a workbook and get an OID, we won't migrate your data feed. We can't. We are unable to. Which means that we would probably have to look at migrating it later, which would mean that might be a completely net new project for both yourself and Athena. We would have to kind of start from scratch. So we want to avoid that situation, right? And just kind of get you seamlessly transitioned over to the new platform. Okay. So this is where we have questions. Let us know what questions we can help you with since you have both of us on the call here, and we also have Karen on the call. Karen.
Sorry, yeah, I just had a question. How are you defining facilities? In Athena, we have multiple departments for each one of our freestanding offices. Is that a unique facility, or because everything from those departments are coming through the same HIE, is it just one facility for us?
Well, let me ask a question because this is being identified kind of more granular now that we're with the new platform migration process. If everything is coming in the one feed, and which I believe for yours, I think you have lots of sites in the one feed, then we'll take that. But if there's multiple locations in that feed, we would like to label that it's coming from that facility or that location. Does that make sense? So we can do that and called an MSH value. We can put on there that it's coming from the Peoria location or the Glendale location. So if you put that information, we're able to identify where it's coming from, which site. So I know you guys have multiple sites. If you list all the ones that are part of your feed, we can branch out your OID for you.
Okay, and I assume then you would want, Athena assigns a department ID associated to each one, so you'd want the ID and the name.
I don't know if we need the ID. At least we probably won't use the ID. We'll use the name. So we definitely want the name. And what was the location? So in that workbook, you can put like Glendale or Peoria. That way we know, because typically we'll look at your website before we get ready to migrate, because we have to do a naming convention. So we'll look at your website to make sure that, these are all the sites you're going that are going to be sending data as part of your data feed. And it helps us identify all the sites and all the names.
And I apologize, you may have said this. The workbook, is that going to be sent out to us again in the newer version for us to finish?
I can send it out to you. Yeah, we can include that. We have everybody that registered today. We have your email, and we can send them out to you.
Thank you so much. That's it.
You're welcome, of course. Any other questions?
Hi there. My name is Valerie. You mentioned at the beginning of the call that this is going to be combined with the Colorado Contexture instance. And so we also have practices in Colorado. I just wanted to confirm that the setup for those practices and that interface isn't going to be impacted at all. And
It
this
is
is
not.
just for Arizona. Okay.
Yeah, a very good question. Colorado, both QHN and also call it the Coreo HIEs
Mhm.
have a completely different setup for their inbound data feeds for Athena. Ours is completely different because ours is a hub and spoke. Theirs is a little bit different. It's kind of like a one-by-one connection. That won't be impacted. However, we are having conversations, just initial conversations, which just started about a week or two ago, with Athena to see if there's a way that we can adopt the way Arizona has done the setup to make it a lot easier to implement. That's our goal. So I guess for now, what I'm saying is nothing for the Colorado will change because we're not ready to migrate any of those data feeds yet. But it could be in the future after we've migrated that they may change the way that they're sending data to us and adopt possibly the way we have it set up as a hub.
Got it. Okay. And then one other question that I have, our setup is a little bit unique in that we have some messages that go to a Salesforce application. Actually, all of our notifications actually goes to a Salesforce platform. Um, so I was looking in Athena and I didn't actually see that we have any inbound traffic in Athena, just outbound. What is the best way for us to be able to identify actually what today the Health Current is sending to our Salesforce, which notifications are going to Salesforce versus Athena? Just because I was having a hard time being able to differentiate that from the interface queue in Athena. So I didn't know if someone on your end would be able to say, oh, we're sending these notifications to your Salesforce feed, these ones to Athena.
Are you talking about your alerts? For the
Yeah.
patient? Oh, gotcha,
Hmm.
gotcha. I really can't speak on that, but I'm
Okay.
assuming if they're sending, I don't know if your account manager's on the call. Cherie, do you know who the account manager is for? I'm
I
sorry,
think it's
what clinic are you in? What organization?
Village Medical.
Oh,
So
Village.
I think
Okay,
it's Kelly.
Kelly. All right. You may be able to reach out to Kelly and she can
Okay.
identify what's going out and what the destination is.
Yep.
Okay.
I was just
Yep.
gonna say, we can have Kelly work with you on what your alert status setup is.
Oh, perfect. Thank you.
No problem. I do want to call out one more thing. Athena Hub comes in with an inbound ADT. That means we're getting all your admits and discharges. We're also getting your demographics. And they also have an inbound web service CCD. That means we're getting your CCD inbound through what's called web services. That will not change. The ADT might based on a couple of requirements that we have, but that's not something that you don't have to worry about. But what I do want to call out is you also have the ability to query the HIE. In other words, you can go to a patient's chart and then you can query to see, what's in the HIE, kind of bring it back into your system and reconcile it against, meds or, allergies or what have you. That functionality is not one that we're going to work on yet. Mainly because we need to get inbound data for you to be able to even get outbound data, right? So it's going to take us a while to migrate all our data feeds. We have several hundreds of data feeds to migrate. So that piece of the implementation will happen in 2025. Hopefully, by the time you go live, you'll have the ability to query us just like you do today, or you may not use it. But I wanted to make sure that you understand that when we migrate you and you possibly are, let's just say you go live in April, you might not have the query functionality right away until such time that we're ready to get that set up. And that'll be another effort that we'll work with Athena, and then we'll let you know what we're doing. And then they'll want some testing, of course, because that's something that we actually have to test with the participants themselves, because you have to actually command the query from us. So I wanted to make sure to let you know that as well. Any other questions? All right. What I want to do is Dina and I will be sending over to you OID instructions on the reason for the OID. We're also going to send some documentation that I believe Kelly updated for us, which is how to register for an OID. We'll send you a copy of the new workbook, and then we'll also send you a copy of the PowerPoint for today. All right. Any other questions that we can help you with? Jessica, let's see here. Oh, is it Sandy?
Yeah, hey Sandra, I may have missed this, but did you give a deadline for the workbook?
November 1st.
November 1st. Okay, thank you.
Yes, yes, November 1st. I mean, I know that's kind of cutting it short, but you're very lucky for this audience because you don't have to fill out too much.
Sandra, there's questions in chat.
Oh, let's go here. Let me see here. Jessica, does it say that on the HL7 registry?
Yeah, it says on the guide that Kelly sent me when I read the instructions, it said that if you register for it by the 22nd of November, you could get a coupon.
Okay, Kelly, I think, oh, she's posting something. Hold on.
I say, Kelly, can Kelly come off mute? Does she have the ability to do that?
Let's make sure to give her that. Hold on 1 minute.
Might be easier for her to explain.
Yeah, hold on 1 minute. We'll get you off mute. All right, Kelly.
Okay, thank you. It's a coupon. It's going to be listed as a coupon. When you go on to the HL7 OID website and you go through the steps to purchase the coupon. Once you put in your payment, you're going to get an email, and they call it a coupon. It's an ID number, and it'll have a link that you will click on, or it will tell you what your coupon code is, but it's basically the code you purchase in order to go back into your account once it's received via your email, and that's how you complete and register your OID. It's not a coupon in the sense that you don't end up having to pay anything or you get a refund. That's just the naming convention that HL7 is used.
Thank you, Kelly.
You're welcome.
All right. Any other questions? Don't be shy. Ask all the questions you have. And if you can't, for some reason, if you're still muted, just raise your hand. Let's see, Christy. Let me make sure. Christy, let me allow your mic. Okay. All right. You're ready to go. Christy, we unmuted you, so you can go ahead and ask your question if you'd like.
Sorry, I had to unmute my own mic. I was sitting there talking. Can you hear me now?
We can hear you.
Perfect. The OID, can that be one OID for tenant and then you branch all the facilities under it?
If tenant is the parent, yes,
Okay.
we can do that. You would just have to make sure to list all your facilities.
Okay.
Okay.
So I don't know what the audience is. I'm sorry. I'm just covering this meeting for someone else. Is everybody on this call associated with tenant facilities, or is this a broad call for multiple vendors?
It's only for those who have Athena as their vendor and they're part of the hub, the global hub that we've set up with
Okay.
Contexture. Yeah.
Perfect. Okay. Thank you.
Yeah. Karen.
I just thought of something to ask. We've been talking about facilities and the individual ones. Will there be some type of a process we need to follow if we add a new location to our organization to let you know? Okay.
Yes, I'm so glad you brought that up. And I think this is good news. This is one for tenant as well, because I know that sometimes the larger companies or even Village, where they acquire a practice or a small clinic or what have you, and they don't let us know, and they they enter it as part of their feed, we'll get failures. In other words, we're not getting those messages because we ourselves have to map those. So yes, we definitely need to know that. Now, that said, we are not implementing anymore into our legacy. And the reason we're not doing that is because it's, like trying to apply for a job at a place that's closing, right? There's no point in trying to set something up when we're going to be migrating to a new platform. So in the future, for any of them that are going to be added, or if they're going to be part of your migration, you could indicate in the notes on the workbook that they're going to be included in your migration. So we need to map them, because we only want you to list the ones that are actually true active data centers. But if you plan on adding more facilities, you can add those. Just highlight those and put a little note saying that you want those sites included. Now, Athena needs to know that information as well, but I believe that with Athena, and I don't know if you know this, Christy, or not, Athena typically tends to just go ahead and add them to the feed and then they're off to the races. But for us, we have to actually map them. Karen, are you going to be adding ones for when we migrate? Is that what you're asking?
Well, we just added one last week. We just opened a new site. I don't have any notices of anything from this date forward, but I know we do. So
Okay.
I just kind of wanted to know if I had to contact you or let the HIE know when we do.
Yes, you should work with your account manager or your, engagement solutions manager and let them know that you're adding a site, because that's something that's important for us. We need to map it.
Perfect.
Any other questions? Right. Again, we'll make sure to make the material available to you, and you can always reach out to the vendor support. It'll be included in the PowerPoint. If you have any questions, concerns, don't forget the looming deadline for November 1st. Please try to get it over to us so that we can make sure that you get migrated and you don't have to worry about waiting to the very end to get migrated. We want to make sure to get your data in. All right, if there's no other questions, thank you so much for spending your afternoon with us. We appreciate it. If you have any questions, again, you know how to get a hold of us.
Thank you, Sandra.
You're welcome. Bye now.
Thank you.
You're welcome. Bye.